Growing up in Durham, Jim Mould loved the outdoors, playing with critters and fishing. By the time he finished college at the University of Michigan, though,
I didn't really have a clear notion of what I wanted to do in life. I knew I liked biology, and I had a choice between field and stream biology or medical school.
So instead of becoming the next Steve Irwin, Mould came to Duke and went on to become a national leader and advocate for the field of primary care. He has helped to lead transformative changes in the way primary care is delivered, which gives patients more input into their treatment options.
My mission at this point is to help people, patients, clinicians, administrators, policymakers understand the value of goal-directed care and help that become a reality.
His patient-focused mission gained major traction in 1986 when he was in the early years of his 30-year career at the University of Oklahoma. In a New England Journal of Medicine article, he championed patient-centered care, citing the dangers of undesirable cascading effects from too much intervention.
We got a lot of requests from insurance companies about, how often does this happen? How can you stop this from happening?
He says this approach to treating patients is particularly important when caring for the elderly.
If you try to fix all their problems, it becomes impossible.
In 1994, Mould established the Oklahoma Physicians Resource Research Network, one of the oldest practice-based research networks in the country. It partners primary care physicians across the state with University of Oklahoma researchers. With this network, Mould led the field in better understanding how to create new practice models and improve patient safety and outcomes. He pioneered collaboration between primary and specialist providers and created a new method called best practices research that is used throughout the country.
Why don't we identify the people who are doing a really good job and then spread what they know to the people who would like to improve?
Mould is a key advocate for the concept of primary care cooperative extension services modeled after agricultural cooperative extension services.
When a farmer has a question or a problem, they call up their extension agent. And that's the way it should be with primary care.
This idea was adopted in the 2008 Affordable Care Act, but was not funded. It is, however, being developed in a number of states, and Mould is active in that effort. Mould chose Duke for medical school not just because it was in his backyard.
The structure of the curriculum at Duke turned out to be really important to me.
Mould spent 6 months between his second and third years of medical school working with primary care physicians in Idaho and Wyoming to get a sense of what it was like to practice in the real world.
And that obviously had a big influence on my ultimate career choice. I was very well prepared when I went to residency.
After a 3-year family practice residency at the University of Rochester and 6 months as a physician in Ghana, West Africa, he returned to North Carolina and joined a family practice partnership in Hillsborough with fellow Dookie Phil Singer.
I learned I didn't like being on call every other night and every other weekend. It was a fairly difficult time, but I also realized that I wasn't really cut out to be a full-time physician in practice.
So, after 7 years in Hillsborough, Mould was recruited to Oklahoma. While in Oklahoma, he completed a mini geriatric fellowship from UNC Chapel Hill and earned a master's in public health at Oklahoma. In Oklahoma, Mould developed geriatric clinical teaching centers for physicians, nurses, dentists, pharmacologists, and others to better address the needs of the elderly.
So I learned a whole lot about the various disciplines, and teamwork became a very important issue.
He has received numerous honors and awards for his contributions to improving public health in Oklahoma. He and his wife Sandy have 2 children and 2 grandchildren. They like the outdoors and hiking and have conquered the strenuous Inca Trail to Machu Picchu in Peru. He's also writing books about primary care, geared either towards patients or care providers. And then there's this. Mould says his time at Duke has helped him in many ways other than the quality of the education that he received.
Sometimes it just helps to be able to say you graduated from Duke Medical School, and people say, oh, you did? Well, that's great. It's just one of those things I think that helps in a lot of ways you're not even aware of.